Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental. I'm talking today about our new laser, the ND Erbium YAG laser that we can use to either do holistic root canals or to prevent root canals. And I'm just phenomenally excited about it. So holistically, a lot of people are very concerned about having a dead tooth in their mouth because the dead tooth, Chinese medicine-wise, can affect your meridians in your body, or the long-standing infection from a dead tooth because they never hurt you can lead to the development of other autoimmune diseases or cancer because your body is constantly burdened with this infection that we never feel or are aware of. So the reason I got this machine was actually to do this procedure called PIPS, which is essentially a photon-induced cleaning of the nerve canal, or sweeps, which is also, if we had to go into the nerve space and do a root canal, it is a more holistic way of doing it because it's using photon energy. So this is the sweeps and PIPS tip, and it's a little glass rod. And this little glass rod, after I remove the decay, I can use the laser to remove the decay, or I can remove it with the traditional way. And then once I'm in the canal space, I can actually go in and just vaporize this area. So there's two options. The first is I go in and, like my other videos showed you, I can have cavity into the nerve and I can switch the setting here just to sterilize the exposed area of the nerve and tell it not to be traumatized. So essentially cauterize the portion that's removed, sterilize it, and then I can do a filling or a crown over the tooth without any root canal. On young, healthy teeth, kids sometimes have playground injuries where they crack a tooth and a big portion's broken off and the nerve's exposed. We can actually crop off just the portion of the nerve that's exposed, sterilize it, and actually all the rest of the nerve that stays in the canal will stay alive. There's nothing else we can do in dentistry that's like that. If we ever touch the tooth with the handpiece, that will start the cell death that will kill the nerve. So if you go to any other dentist that doesn't have this technology, they're going to tell you you have to have a root canal. And especially on the front teeth, as kids age, it leads to the tooth being more brittle. It'll always result in root fracture down the road, or you'll end up with those ugly discolored teeth where people have gray, green, brown, black, or what we typically call a dead tooth. Big discolored area on the tooth from the blood vessels and the nerve dying, essentially leak into the inside of the tooth and turn it gray. So this, using the laser, will prevent all those things. If I wanted to do a root canal with the sweeps tip, the way it works that's different is this tip is attracted to the water molecules inside the nerve. And it can actually get, if you look at a tooth, it's like thousands of drinking straws on the inside. So holistically, when people say they don't want a root canal, the big concern is that all of these hidden tubules that are you can only see on an SEM microscope, we're not able to clean or sterilize them. So the tooth ends up being reinfected or harboring infection as all of this bacteria is left to sit in here. The reason this is different is this is drawn towards the water molecules, and also I am constantly irrigating the area with fresh ozone water also. So it's attracted to the water molecules in the water I'm using also. And we insert it into the canal, and without using the typical root canal instruments, which are these little barbed brooch files. If you've ever seen Finding Nemo, it's a pretty hilarious version of how we do root canals. But instead of using that, and the typical way is use these files and these metal instruments, ream them in there, soak the tooth in bleach, literally household bleach, and then we fill it with the rubber material and we close it up and then the patient goes on their way. This will go in, I don't even have to insert it all the way into the canal, and it creates a backflow. So the photon energy breaks up the debris that's stuck in all of these canals. And I will attach some videos to the site that actually show what that looks like under the microscope. It just blows your mind. And it allows our irrigant, in my case I use ozone water, to get inside of those canals and tubules, kill the bacteria, and then we use a bioceramic sealer to seal it up. So we're able to get all the way down to the apex, and then also get around any curves or any hot side lateral canals that we can never reach with the traditional root canal instruments. So I'm really, really excited about incorporating this technology. I hadn't done root canals in years just because of the concerns holistically about how they were for the patient And also, I just never felt good that I wasn't able to reach all of these side portals of exit for the nerve. And now I know I can. So I invite you to come in and talk to me about if this is a procedure that would work for you, to have a photon-induced PIPS nerve recovery done, or a sweeps root canal. Really fascinating stuff. Thank you for watching, and come in anytime to ask me questions.